Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved
and
lives?
that's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal. It was data chaos.
Who was politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
They fired Dr.
Go to
GRILLS.
the Trump Surgeon General.
They fired Dr. Grau. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krause,
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID.
Hey everyone, welcome back to the channel. Today we're diving into a heated Senate exchange between Senator Warner and the Health and Human Services Secretary. This conversation covered everything from COVID-19 deaths, vaccine effectiveness, Medicaid cuts, rural hospital closures, and even community health centers. Stick around, because this debate reveals some shocking gaps in leadership. And before we get started, don't forget to hit that subscribe button so you never miss an update.
Senator Warner.
Mr. Secretary, I agree with a lot of my colleagues' statement. I actually had hoped, I didn't support you. I thought taking on chronic illnesses was going to be important. I've got 2 kids, as we discussed when you met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that, because there was so much data chaos coming out of the CDC, and there was so many perverse incentives, and these are model
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved
and
lives?
that's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal. It was data chaos.
Who was politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
They fired Dr.
Go to
Krause.
the Trump Surgeon General.
They fired Dr. Grau. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krause.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, you know, I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you've got to one. I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then, how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there is not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing health care policy, not being the doctor in residence for all of America. I hope I can just say, I'm still going to trust my doctor rather than your health advice. And obviously, Tom Cotton's going to, who knows who he's going to trust. But let me go back to policy for a couple, so maybe we can lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote-buying mechanism when Medicaid's getting cut than what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%. So there is actually ability to get rural providers.
President Trump supports that, and we support
Do you support?
that.
You support. Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare, so you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill, because across America,
What about what?
hospitals are shutting down on their OB-GYN services. Try to have a baby. I don't know about in all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OB-GYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OB-GYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
Senator Warner didn't waste any time. He directly challenged the secretary for focusing on things like red dye and seed oils instead of addressing real chronic illnesses that affect millions of Americans. Warner pressed even harder on COVID-19 deaths, asking if the secretary knew how many Americans had actually died. To everyone's surprise, the secretary admitted he didn't know, blaming chaotic CDC data during the pandemic. The questioning got even more intense when Warner asked whether the COVID-19 vaccine saved lives. The secretary wouldn't give a straight answer, saying he wanted to review the data. Warner accused him of being uninformed and reminded everyone that past officials who questioned vaccine orthodoxy were fired. This raised serious concerns about transparency and accountability in public health leadership. The conversation then shifted to community health centers, which Warner called absolutely vital for underserved areas. He warned that Medicaid cuts could strip away access to nutritionists and basic care, especially in rural and low-income communities. The secretary pushed back, denying that cuts exist. But Warner brought receipts, highlighting the looming closure of a rural hospital in Franklin, Virginia, and warning that more closures could follow. And hey, if you're finding this breakdown helpful, smash that like button and subscribe for more deep dives into stories that matter. Warner didn't just criticize, he also offered solutions. He proposed legislation to increase reimbursement rates for rural hospitals through the area wage index. Surprisingly, the secretary agreed to work with him on it, though he cautioned it could raise costs for Medicaid and Medicare. Warner also raised the loss of OB-GYN services in rural hospitals. The secretary committed to discussing possible protections, showing there might be room for bipartisan solutions. Senator Warner closed by inviting the secretary to visit a community health center in Virginia, urging him to hear directly from the people most affected. Warner's message was clear: Americans want better health, but they also fear losing the little care they already have. This exchange was a reminder that healthcare isn't just about policy, it's about real lives. What do you think? Was Warner right to call out the secretary, or do you think the secretary had a fair point about data and costs? Drop your thoughts in the comments below, and don't forget, hit subscribe and turn on notifications so you never miss our next breakdown. Thanks for watching, and I'll see you in the next video.